Dr. Nora Vinh, and today I'd like to tell you about what your insurance can and can't do for you. I really want this to be as clear for you as possible so that when you are presented with a treatment plan, you have realistic expectations about the insurance and your patient portion. Nothing is more confusing than the fees and insurance when it comes to healthcare. For example, a year ago, I broke my leg just 1 month after my wedding, and I have a great PPO plan, but I had no idea what my plan would cover, and for a year afterwards, I kept getting statements from the hospital. When I tried to figure out the fees with the insurance, no one could give me a clear answer, all for a simple broken leg. Luckily, dentistry has not become that confusing, but it is headed in that direction. I won't speak to any particular brand or company or policy, but I will speak in generalities, so they apply to all plans. First myth that patients believe about insurance is that it will cover 100% of everything. This simply is not true. Your plan covers a percentage of your treatment. This percentage is negotiated between you or your employer and the plan. For example, your insurance could cover 20%, 50%, 80%, or even 0% of your treatment, and there is a clear disclaimer from your insurance, not from us, your dentists, that they may decide not to cover that treatment at all. And that's when things get ugly. You, the patient, thinks we are falsely or wrongly submitting a procedure that's not covered, and we, the dentist, are submitting the correct covered procedure, but we are getting blindsided by the plan because there is no guarantee of coverage. And a lot of plans have exclusions or limitations on what they cover for you. For example, you need a filling, but you want the white filling, not silver. Naturally, your plan proposes they cover 50% of the white filling fee contracted with your dentist. However, an auditor at the plan may review your file and think that they might just want to cover 50% of the fee for a silver filling and not even notify us or you about it until you get the explanation of benefits. Since the fee for the silver filling is usually much lower than the white, suddenly you owe more money than you were originally proposed to in the treatment plan. This kind of thing happens all the time in a process called downgrading, and we have no idea if the insurance company will do this. It's really frustrating for both us, the dentists, and you, the patients. Second, it's impossible for us, the dentists, to waive your copays. The penalty for such a practice is usually a dentist's license gets suspended after a lengthy and drawn-out investigation. I get asked to waive copays all the time. Here's a page taken directly from Delta Dental's website, and I quote, "Accepting your insurance as payment in full and disregarding your coinsurance, copayment, or deductible results in overbilling the insurance company. It's also against the law in many states and is viewed by the dental profession as unethical. It's also a violation of the dentist's contract with Delta Dental." So please don't put your dentist in that compromising situation. Your patient copay protects you, the patient. It's your agreement to let your dentist bill your insurance for that procedure and only that procedure. When your copay is waived, the dentist can pretty much bill for whatever they want. Your copay says, "I am paying this contracted fee, so the dentist can do this particular work and bill for this procedure." The last thing I wanted to talk about is the yearly maximums of dental insurance. You know, the cost of living increase every year, taxes keep rising, costs of business increase, the cost of supplies also increase because the technology keeps on improving. However, one thing that has not changed since the 1970s is your dental yearly maximum covered amount. The best of all PPO dental plans will cover a maximum of about $2,500 per year. However, the average cost of a crown is already at least $850 for the most low-end crown. And sometimes the uncovered procedure is actually better for you, but you really should be aware of your choices and get the appropriate education. So what is dental insurance exactly? I looked up its definition, and it is, I quote, "designed to pay a portion of the costs associated with dental disease and accidents to teeth." Note that it is not defined as a way to maintain the best health and appearance of your teeth, nor is it a way for you to get what you need for free. If you waited until you almost lost your teeth before you went to the dentist and used your insurance, your teeth and gums would likely be in very bad health. In an ideal marketplace, you should be able to negotiate your dental treatment not based only on what insurance will cover, but on what you really need and want. Your decisions about your dental health must be based on what you feel is best for you in the long run. Doing treatment only around what insurance will cover ultimately leads to disappointment and confusion, because the moral of the story is neither you nor the dentist will really know what they decide to cover. I really hope this very basic primer has given you some insight on dental insurance. Thank you for watching. This is Dr. Nora Vinh.
Created using Powtoon.